Hello friends, I am Dr. Priyank Mittal, corticobasal implantologist working in गाजियाबाद उत्तर प्रदेश. सो एक कुछ टाइम पहले मैंने अपना एक केस डिस्कशन किया था. आज मैं आपके सामने फिर एक नया केस लेके आया हूँ. एक अच्छा केस है. अपर आर्चफुल एंड लोअर में हमने कुछ टीथ रिटेन करने की कोशिश करी है. सो देखेंगे आपकी बायलेटरल मैंडिबुलर क्वाड्रेंट्स को कैसे रिहैब करना है on the immediate loading basis. So this is the OPG which you can see here. Your maxillary arch is quite resolved, and you can say pneumatization of sinuses which is quite approaching to canine area. In the mandible we have posteriors, only root stumps are there with periapical radiolucencies, but lower anterior area is firm enough and patient do not want us to touch them. So as I always say, diagnosis is the first thing we should do before starting any case. So that way we have taken a picture, a sad man who cannot eat the food as his family is eating. He wished something could be given so that he can eat with the family, sitting at the same table. So then we have the intraoral pick. The lower anterior seems good enough with periodontium, with you say bone support, but the upper arch is already been extracted and resolved rich. So as I always say, again in the diagnosis part only we have to evaluate the inter-arch distance and the relation of the maxilla and mandible. So in this right side peg you can see that maxilla is not in line with the mandible. It is quite resolved and at the back side, and definitely the ridges are also not matching. Same is on the left side. You can see the maxillary mandible relation also. This maxilla is too much, you say, inferior or internally to the mandibular anteriors. This is maxillary arch, this is mandibular root stumps. This has to be removed because there is a furcation involvement, roots. So this is the final OPG which we have achieved after placing the implants. Here we have placed two zygomas, rest are all basal implants, lower and upper also. So why do we need zygomas here? This is the topic for discussion, because if we again go back to the original OPG, we can see there is expanded pneumatized sinus in both the arches, which makes it very difficult to place any implant in this zone. So even if I leave any implant in the nasal area and then directly put the implant in the pterygoids, then a good amount of space will be left in the, you say, anterior posterior direction, which will give kind of cantileverage to the processes and which can lead to implant failure. So we need to eradicate it. The best way to eradicate is your zygoma implants. So this is the entire area which has been pneumatized. This is your zygomatic bone, both sides we can engage. So this is how we placed it. Two zygomas, rest are all basal implants. This is how the intraoral wiring looks like. Transsinus flapless zygomas are always located on the palatal aspect. This is mandibular double wire welding. Now look at the wax up and trial. Can you appreciate where is that zygomatic implant? So this is the beauty of lab. This is what we have to give to lab. The finely, you say, trimmed your abutment so that we can have a such beautiful appearance. Look at the jaw relation and the teeth setting on the articulator and the mouth as well. This is in the mouth. Patient was quite happy to see it. Mandibular are the temporary teeth which we have already delivered and luted now, and this is all within the time zone of 24 hours. Patient is happy to see the smile. Now this is the final OPG without wiring, and that was with wiring. So now we are waiting for the maxillary arch processes to be delivered final, and we will carry on this video after some time so that we can show you images of the final process also. Thank you.